just going to start with applying some medicated Ayurvedic oil on the lower abdomen, just because we are going to check what my client's uterus moves like. And our aim today is to restore good structure and function, of course, circulation and such to this area. This particular client has a blocked tube, and we are going to try and decrease tension in that space to hopefully help with the process of getting some opening and passage in that area. So here I am, just coming over the pubic rim, checking for mobility of the uterus itself. And as you can see, the uterus glides so much better from the right side than the left. Is that where the blocked tube is? Yes. So my client just confirmed, yes, the blocked tube is on the left, and then we notice that in that decreased motion. So here we stay very pain-free. I am not digging in deep to my client's tissues. I isolate the point of tension and check in with her, like, is that feeling a little bit tight and sore? Yes, she says yes. I help the abdominal slacken a little, and go ahead and give me a deep breath into that lower abdomen right there. I use the breath to gently mobilize the uterus and exhale. There we go. And then increase the stretch, and then drop that in. At all points, we are checking for comfort. We never want to do anything that is noxious to the structures themselves. This person's uterus right now feels a little full. The lining feels thick. The person does say that they are close to their menstrual cycle, which makes a lot of sense to me, because it feels like a uterus that is quite full. Maybe will shed soon. Go ahead, give me a nice inhale. Beautiful, stay right there. And we use that again, that inhale and that natural stretching of the abdominal tissues to mobilize. Exhale for me. Nice and easy. Wonderful. There. And we mobility test again. And this time, if you notice, with the same amount of stretch, the movement from the left is a little better. Still restricted though than the right. So of course, we are not by any means claiming we unblocked her tube in like the 2 minutes you've been watching this video, but we are easing up the restrictions in the myofascia around the tube to help the natural flow of fluid through that tube. Go ahead, give me a good inhalation right in that spot. That's right, and that phonics. Go ahead. Wonderful. Hold that breath in there and exhale. My lower hand is at the pubic rim, just adding an extra stretch, extending the stretch from the tube down towards the cervix. And once again, I just help ease that out. Further, I am not going to do this on video, of course. We would address some of the lower tissues right at the pubic junction. And then as these restrictions ease up, we would use one finger, just one digit internally through the vagina to create opening in that broad ligament that connects this tube all the way down to the cervix. Basically, we experience, depending on what happened with the person, some shrinkage, tissue tightening in that area, which affects the passage of fluid through. And then, of course, if the goal is fertility, the ability for the fertilized ovum to implant there in that tube. So that's all we are going to go over today. If you want more details on how to support your clients through fertility for easing restrictions around the uterus, around the fallopian tubes, the ovaries, follow us, and we will be rolling out information on training soon, and we hope to see you here again. Bye-bye.